Hello, everyone. It's Tuesday, August the 23rd. Regretfully, we've got 23 additional deaths. Now, 19 of them are reconciliations, and I think that's correct. No, I'm sorry. I'm in error. You know, we have 23 additional deaths since my last briefing. The 7,231st death is an 82-year-old male from Summers County. The 3,232nd death, an 80-year-old female from Webster County. The 7,233rd death, a 73-year-old female from Monroe County. The 7,234th death, an 80-year-old female from Grant County. I get this, and this is tragic beyond all comprehension. The 7,235th death is a 13-year-old female from Nicholas County. This is the youngest COVID death that we've had so far in West Virginia. It's just terrible, just plain terrible. The 7,236th death is a 96-year-old female from Cabell County. The 7,237th death, a 58-year-old male from Hancock County. The 7,238th death, an 83-year-old male from Boone County. The 7,239th death, a 90-year-old male from Ohio County. The 7,240th death, an 87-year-old female from Mineral County. The 7,241st death, a 91-year-old female from Kanawha County. The 7,242nd death, a 66-year-old male from Raleigh County. The 7,243rd death, a 69-year-old female from Marion County. The 7,244th death, a 77-year-old male from Webster County. The 7,245th death, an 88-year-old female from Webster County. The 7,246th death, an 86-year-old male from Putnam County. The 7,247th death, a 59-year-old male from Kanawha County. The 7,248th death, a 79-year-old male from Berkeley County. The 7,249th death, an 84-year-old male from Cabell County. The 7,250th death, a 59-year-old female from Mineral County. The 7,251st death, a 92-year-old male from Kanawha County. The 7,252nd death, a 60-year-old male from Kanawha County. The 7,253rd death, a 74-year-old male from Greenbrier County. Again, I ask for your prayers. I ask for your awareness that this is not over. I absolutely so much ask for your prayers for this family and this little 13-year-old beautiful girl that we lost. And not only that, all these great people. We have 2,632 active cases in West Virginia right now, 811 new positive cases in the last 24 hours. Our daily positivity rate at 18.33. Our cumulative rate at 8.44. We have 565,000 plus that have recovered from COVID. 340 hospitalized right now, 49 in the ICU units and 15 on ventilators. We have a sprinkle of counties that are green, mostly where you have our counties are in the yellow. We have one gold county, and that's Hardy. I can't tell you enough how important it is to get your booster shots. And absolutely, I want you to know that that I'm going to continue to encourage you in every way, being totally respectful of all of our freedoms that we have, but I'm going to continue to encourage you in every way to get your booster shots and to get vaccinated, no matter what the age may be. I mean, how tragic is it for us to lose a beautiful 13-year-old girl? Our numbers continue to slightly get better and everything. The vaccine calculator is up on our website for you to use and get registered. It'll remind you about getting your shots. All the COVID information is up on our website. The long-term care facility outbreaks now are 112. There's still none in our church community that we know of. That corrections, we have 116 inmates and 47 staff cases at this time. We know about our homeowners assistance program and, and how valuable that can be. If you'll just take your time and call us and see if we can get you registered, it may really be able to help you out. The rental assistance program, it was for renters and for landlords as well. It now will expire, and we will stop taking applications officially at 11:59 p.m. on August the 26th. August the 26th at 11:59 p.m. on Friday, we will absolutely stop taking applications for the Mountaineer Rental Assistance Program. I encourage you over and over about giving blood. I ask you to check with your physicians, and please consider it. Now, we had an award that, was last Friday that was given. The West Virginia Women's Commission held its annual Legacy of Women's Award ceremony. 11 remarkable women were honored for their contributions to West Virginia. The top award is called the Kathleen Johnson Women's Making History Award for lifetime achievement. And I don't know that it could have been given to a better young lady or a better person within the state of West Virginia, but Dr. Sherry Young received that award. We know how much that Sherry or Dr. Young did, and how that she was always out there on the front lines battling and doing everything from all the countless clinics and everything that she did. It was truly amazing. I mean, I know she had a team around her, but you got to have a leader. And really and truly, Sherry, you did great work. No telling how many lives you saved and how often you put yourself at risk and ran to the fire. And we congratulate you on being a true West Virginia hero in every way. So great work, and really proud to know you very well and see all your great accomplishments. So thank you so much. That's all I've got right now.
All right, thank you, Governor. Now we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just let me reinforce part of what the governor just talked about. The governor read 23 additional West Virginians that we've lost. And his point was COVID is not over. COVID is not over with. And of those 23, while most all were over the age of 65, as we've pointed out many times, 3 of them were not, 59, 60, and a 13-year-old child. We need to continue to pay attention to what the governor presses us on with vaccines. To that point, the Interagency Task Force yesterday ran a tabletop exercise. A couple of the items that were accomplished there updated our data analytics assessment on hospitalizations. We still believe that 500 is the number that we need to pay attention to, and that's based on the seasons and what we're dealing with the flow of patients in and out of hospitals, as well as staffing issues and challenges that would come from COVID, both with increased patients and staff outages. So 500 is still the number that we watch and pay attention to be able to provide the governor with some recommendations for things that we might need to do otherwise. In addition to that, the tabletop exercise and the GIADF partners spent a great deal of time preparing for this next booster. You've probably heard it by a couple of different names: the bivalent booster shot, the bivalent Omicron booster shot. So let me try to break it down for us in West Virginia in simple terms. It is the updated version, updated booster, and it is focused on the original virus as well as the BA4 and BA5 variants of the virus. And the BA5 in West Virginia now makes up 87.2% of our total sequencing numbers in the state. So it is the predominant variant of the virus. So again, think of this as the updated version focused on helping to improve our immune response to 2 different versions of the virus, and one being the most predominant that we face now. We are in the process of working, and yesterday also occurred was an all-county call with our partners from across the counties and our DHHR, our health department partners from across the state. And the ordering process has begun for this updated booster version. And an order was placed yesterday. And then an order will be placed on the 29th. And then on the 29th of August, it will be opened up to all. The focus of our effort initially in this effort going forward, once the booster is authorized by the FDA and then ultimately recommended by the CDC, even though we've been given the opportunity to order, there are still approvals that have to go in place before it will be shipped to the states. So our focus will be based again on the number of West Virginians we've lost in these age categories. We're going to focus on long-term care facilities, persons over the age of 65, those who are moderately or severely immunocompromised, and then also healthcare workers and first responders. So a lot of work has gone into planning and preparation with all the partners. That's the focus of why the governor has the interagency task force and why he continues the interagency task force going forward. The last thing I'd leave you with is the calculator. The calculator is currently updated and will be updated again once the other version of the booster is finally authorized and approved by CDC. So please pay attention to the calculator or use the helpline, the hotline that's available to you. Thank you.
All right, thank you, sir. Secretary Crouch and Dr. Inamjad are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. Governor, I know there's no way to mitigate all danger and hazards out of our lives. That's impossible. And I also know the water runs downhill, and we literally live in a place called the Mountain State. But I've been doing this since 1985, and I've covered floods in probably 4/5 of the state. And they're always the same story, and it's always a terrible tragedy. So in your mind, as you look at the big picture, and I know you're going to tour today the latest disaster area, what big picture fixes can we do beyond flood walls, beyond some of the the lock and dam system, beyond the traditional methods that have been in place, and of course FEMA has the program of mitigation of moving people out. Do you see anything in the future when you put your thoughts to it that we could do to make a sizable difference in the hazard threat and move more people out of areas which are prone to flooding, which we know flood, and which have flooded continuously over the years and will continue to do so? Thank you. I appreciate it.
Well, Kenny, we're going to be touring a bunch of that in just a little while, and Kenny, it's tragic, and we all know it's tragic. Just to be perfectly honest, Kenny, if you look at a great big picture, and I said this in my State of the State address, I don't know, 2 or 3 years ago. I said, West Virginia needs to build lakes, lots of them. Now you've got all these government agencies that can cause you every kind of level of grief in the world to be able to get the permitting process done to be able to do that. Those lakes would absolutely help us with energy generation. They would help us with absolute tourism. It would be off the chart. But more than anything, it would truly help us with flood control. Now, we basically just take a big idea and decide, well, it's just too big. We can't really do anything with it, so basically it goes nowhere. With all that being said, on top of that, we've said many times that what we're going to do is level out a piece of land, up on top of a mountain, and we're going to put people up on top of a mountain, and then People don't want to live up on top of the mountains. And really and truly, from the standpoint, if they lived up on top of the mountains in the middle of the winter, it'd be dangerous as it could be from that standpoint. And so people choose in this great state to live where there's a level spot that you can live and absolutely believe that for the most part, it's as safe maybe can halfway be. Now, with all that being done, we don't have all those places. And we just plain don't, and we are at risk to some degree. And until we decide to embark upon big ideas that would really truly control floods and generate lots and lots and lots of energy and absolutely do things that would perpetuate tourism to this state, off the chart. But the problem is really simple, isn't it? You've got government agency after government agency that are going to stand in the way, and it would take years and years and years maybe to be able to build one lake. But if we built one, at least that's one. So with all that being said, Kenny, I don't hold out a lot of promise. We sure do have areas that are on top of mountains that we could have people, where the residences could be there. But literally at the end of the day, it's very, very, very difficult to figure out, how to solve this issue because people don't want to live there. They want to live close to town and everything else, and there's just not the space for them to be totally immune to big rains and flash flooding.
All right, thank you, Kenny. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. Governor, any update on LIV Golf at the Greenbrier? Thank you.
Well, Brad, one thing that I've done, I've stayed, under the radar. I'd love to see it happen, from the standpoint of bringing, another big event to West Virginia. It'd be great, from the standpoint of conversations, ongoing conversations. They've surely had ongoing conversations and everything. I got the opportunity, to meet Greg Norman and say hi to him, and the thing that I was astounded with him about is, he went around the golf course at, 6 o'clock in the morning and came up with an idea on the relocation of the tee box on the 16th hole on the old white, and that tee box. He said he put it back on the other side of the creek and everything. He said to me, what would it take around here to get 2 sycamore trees cut down? Well, my answer would always be, try to move on and make progress. And my answer would have been, get a power saw. But nevertheless, it was an amazing pickup because all the time that our folks had been there, all the time the PGA had been there, I had never heard it, and somebody surely would have come to me and mentioned it to me. But a really talented guy. I didn't get to be with him hardly any at all, but just a few minutes and everything that morning and everything, and said hi. But he, he's a nice guy, and that was the first time that he'd seen the golf course, and they are genuinely interested, but they're genuinely interested in a lot of places all across this country, if not all across the globe. And I don't like the food fight that's going on between the PGA Tour and them. I think there's plenty of room for great competition. And so I think we would embrace and welcome them to come to West Virginia. But that's probably still a ways away.
All right, thanks, Brad. Next is Steve Adams with Ogden Newspapers.
Yeah, Governor, I'm going to follow up on Kenny's question a little bit. You've mentioned the lakes idea about any time I've ever asked about flood mitigation. I just did a little bit of a Control F search on the statewide flood protection plan, and it doesn't mention anything about building lakes as needed for flood mitigation. You've got a flood resiliency officer currently doing a full-on review of that statewide flood protection plan in order to see, because since it's nearly 20 years old, they're trying to figure out what in it has been implemented, what hasn't been implemented, what's outdated, what they need to change. They expect to have that review done by the end of this year. If they come back with new recommendations, will you spend the remainder of your term as governor trying to get as many of those new updated flood protection plan recommendations done as possible? Thank you.
Well, Stephen, just think just a second about this. You know, have I not said over and over, surely the worst weather event or whatever that I've ever been involved with in any way was the flood of 2016. And I'll never tell these people, you know, they're going through these really, really tough times right now that, you know, I know what you're going through, because I don't believe in doing that. But I waded a lot of mud, and we looked for a lot of bodies for a long time. And it was the worst of the worst of the worst for me. Now, you won't have to ask me any more about this. I'll do anything and everything in my power, and always tried and will continue to try to do just that. From the standpoint of us pursuing or not pursuing or not actively pursuing additional lakes, you know, from my standpoint, that would be, that's not good. But the reality is just really simple. Every time it comes up and every time someone looks, it's always, there's no way it'll ever happen. No way. You know, it's just absolutely too tough. You know, and so with all that being said, from the standpoint of doing anything and everything that I can do to try to help these folks to be able to not experience this terrible tragedy and everything, Stephen, you won't have to ask me anymore. You really didn't have to ask me this time. Really and truly, I welcome your question, don't get me wrong, but worst event that I've ever been through in my life. That's all there is to it. And you know, I'm here to try to help as many folks in West Virginia as I possibly can all the time, and it is absolutely always top priority with me.
All right, thanks, Steve. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I had a couple of questions about the bivalent vaccine for either General Hoyer or Dr. Amjad. So first of all, I know this is a booster, but what does this mean for folks who have yet to be vaccinated? Do they need to go through the primary series before they can get this Omicron-specific booster, or can you start with this one? And then General Hoyer, could you share whatever you can about the initial orders? How many did we place? Thank you.
Dr. Amjad, please start, and then General, maybe you can fall in after that.
Yes, Governor. Charles, to answer your first question, people will need to have their primary series or 2 doses before they get a booster. I mean, this is a booster dose. And so in order for it to work, you do have to complete that primary series of either Pfizer or Moderna, whichever one you prefer, before you can get the booster, which is the new one coming out.
Yeah, and Charles, I'll need to get you numbers, because we're consolidating what was ordered at the local levels with the health departments, and then a central order that we have made with the Joint Interagency Task Force, several thousand doses, and as part of the TTX, or the tabletop exercise, we're looking across the numbers of people, and as Dr. Amjad pointed out, has to be people who've had that primary series first. So that, and then the age factor limits the numbers that we'll get in the first wave. But the other thing I want to point out, Charles, is we have no indication that we will have any challenges with availability of that booster going forward.
All right, thanks, Charles. Governor, I'll turn it back to you.
Well, I really don't have anything else. You know, I appreciate the questions, and you know, and I think our media does great work. We should always commend the work that they do, and the questions they bring up. But the only thing I would add is just this: is please pick up on this, West Virginia. You know, our general just went through the tabletop exercises, and they confirm again that when we exceed 500 people that are hospitalized from COVID in our state, we start pushing the limits of our systems on our hospitals in a big way. And we're at 340 right now. It's not wintertime yet. The cold weather of the fall has not gotten here. Please pay attention to that, West Virginia. The only way in the world that I know today, and if I had any other means, I'd tell you, the only way that I know really and truly that we can keep that number down or make it absolutely maybe go away is vaccinations. That's all I know. And if I had anything else, I'd bring it to you. You know that I would. You know, but remember that number. If a great general is telling us that 500 hospitalizations in West Virginia begins to push us to a threshold that we don't want to have. We do not want to have in West Virginia. We're 160 folks away from that right now. We're at 340 right now. The last thing I would leave you with is this: we've lost 7,253 people in West Virginia, and that's really sad. But it absolutely, to me at least, takes on an absolute different level of sadness when you think that we've lost a 13-year-old, beautiful little 13-year-old girl. Please, please, please keep her and all of her family and loved ones in your prayers, as well as all those of the 7,253 that we've lost. Thank you so much. That's all I've got.